top 5 essential vitamins for individuals with diabetes. It is often said that diet and x-rays form the cornerstone of diabetes management, yet there remains an often overlooked aspect that could prove transformative: the right vitamins. These 5 vitamins, supported by scientific research and real-world results, have the capacity to significantly enhance blood sugar control. For those living with diabetes, the constant monitoring of blood glucose, meticulous meal planning, and anxiety over potential complications can seem overwhelming. However, incorporating key vitamins into one's regime can provide invaluable support for the body in ways that may not have been previously considered. Magnesium, the first vitamin to consider, is magnesium. Frequently regarded as just another mineral, magnesium is fundamentally essential for individuals with diabetes. It is involved in over 300 physiological processes, many of which are directly linked to the body's management of blood glucose. Magnesium assists with the glucose metabolism and bolsters insulin function, areas where those with diabetes are often compromised. Moreover, research indicates that individuals with diabetes are significantly more prone to magnesium deficiency, and inadequate levels can exacerbate insulin resistance, increase inflammation, and disrupt blood pressure regulation. Ensuring adequate magnesium levels can be transformative. Studies published in reputable journals, such as Diabetes Care, have revealed that magnesium supplementation can substantially improve insulin sensitivity, enabling the body to utilize insulin more efficiently and reduce blood sugar levels. Additional research in the American Journal of Clinical Nutrition has demonstrated that magnesium helps lower inflammation, a key factor underlying complications such as cardiovascular disease and nerve damage. Furthermore, magnesium aids in reducing high blood pressure, thus easing the strain on the heart and kidneys, organs already vulnerable in those with diabetes. While magnesium is present in foods such as spinach, almonds, and black beans, dietary intake is often insufficient for those with diabetes, making supplementation advantageous. Magnesium citrate or glycinate are the preferred forms due to superior bioavailability, with a recommended daily dosage between 200 and 400 grams. As always, one should seek medical advice prior to commencing supplementation to ensure safety and appropriateness. Vitamin second on the list is vitamin D, often referred to as the sunshine vitamin. It plays a critical role in the regulation of blood sugar and insulin production. There is a high prevalence of vitamin D deficiency amongst individuals with diabetes, which is problematic as low levels are closely associated with increased insulin resistance. This means the body is less able to utilize insulin effectively, thus raising blood sugar levels. Furthermore, inadequate vitamin D impairs pancreatic beta cell function, cells which are pivotal for insulin production, and heightens inflammation, thereby worsening complications such as neuropathy, cardiovascular disease, and renal impairment. Vitamin D supplementation yields promising results. According to the Journal of Clinical Endocrinology and Metabolism, supplementing with vitamin D can markedly improve insulin sensitivity. Another study from Diabetes, Obesity and Metabolism demonstrated that vitamin D enhances beta cell function thereby augmenting the pancreas's efficiency in insulin production. Notably, vitamin D also possesses potent anti-inflammatory properties, supporting blood vessel health and reducing the risk of diabetes-related complications. Additionally, it promotes bone health, which is crucial given that individuals with diabetes have an elevated risk of fractures. The most effective means of obtaining vitamin D is through sunlight exposure. However, for many, particularly those in less sunny environments, supplements are necessary. A recommended daily intake ranges from 1,000 to 4,000 international units, IU, of vitamin D3. Maintaining levels between 30 and 50 nanograms per milliliter is optimal for health. However, periodic monitoring by a healthcare professional is advised for personalized guidance. Chromium. The third important nutrient is chromium, a trace mineral that, although less recognized, is integral to blood sugar regulation. Chromium enhances insulin's capacity to transport glucose from the bloodstream into cells, effectively serving as an indispensable partner to insulin. Deficiency in chromium can impede this process, resulting in elevated blood sugar and worsened insulin resistance. Scientific studies corroborate chromium's benefits. Research published in Diabetes, Technology and Therapeutics demonstrates that chromium supplementation can significantly increase insulin sensitivity and decrease fasting blood glucose in those with type 2 diabetes. Further, the Journal of Clinical Pharmacy and Therapeutics notes that chromium picolinate, a highly bioavailable form, can reduce hemoglobin A1c, an essential marker of long-term blood sugar control. There is also evidence to suggest that chromium may help lower cholesterol, further mitigating the cardiovascular risks associated with diabetes. And the customary recommended dosage ranges from 200 to 1,000 micrograms of chromium picolinate per day. Chromium is present in foods such as broccoli, whole grains, and lean meats. Yet, dietary intake is often inadequate, especially if a deficiency already exists. The chromium supplementation is considered safe within suggested limits, but professional consultation is prudent, particularly for those on insulin or other diabetes medications. Omega-3 fatty acids. Fourth on the list is omega-3 fatty acids, a group of beneficial fats vital for heart health and diabetes management. Omega-3s, particularly eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA, act as natural anti-inflammatories, countering the chronic inflammation that underlies both diabetes and its complications. Persistent inflammation can aggravate insulin resistance, damage blood vessels, and increase the susceptibility to heart disease. Omega-3s are crucial for cardiovascular protection. People with diabetes are at a significantly heightened risk of heart disease, yet omega-3s can help mitigate this by reducing triglyceride levels, improving lipid profiles, and supporting stable heart rhythms. Research reported in Diabetes Care confirms that omega-3 supplementation can effectively lower triglycerides, providing a key strategy for reducing cardiovascular risk. Some studies also suggest that omega-3s may enhance insulin sensitivity, although individual responses can vary. The recommended method of obtaining sufficient omega-3s is via high-quality fish oil or algae oil supplements, delivering a combined daily total of 1,000 to 3,000 milligallons of EPA and DHA. Algae oil presents an excellent plant-based alternative for those who do not consume fish. Alternatively, increasing dietary intake of fatty fish, such as salmon, mackerel, and sardines, is recommended, with a suggested 2 servings per week. Plant-based foods like flax seeds, chia seeds, and walnuts also provide omega-3s, though these are in a form less efficiently converted by the body. While omega-3s are generally safe, excessive doses may increase bleeding risk, particularly in those on anticoagulant therapy, so consultation with a healthcare provider is advised before significant supplementation. Vitamin E. Lastly, vitamin E warrants attention. This potent antioxidant is particularly significant for individuals with diabetes, as it combats oxidative stress, a major factor in the development of diabetic complications. Elevated blood sugar generates an abundance of free radicals, which in turn contribute to inflammation, vascular damage, and accelerated progression of diseases such as heart disease, neuropathy, and nephropathy. Vitamin E works to neutralize harmful free radicals, thereby decreasing oxidative stress and protecting cells from damage. Research has shown that vitamin E can improve endothelial function, which is essential for the health of blood vessels. For individuals with diabetes, this is crucial as endothelial dysfunction is a precursor to cardiovascular disease. A study featured in Diabetes Research and Clinical Practice found that vitamin E supplementation resulted in reduced inflammation markers, such as C-reactive protein, CRP, in those with diabetes. Additionally, vitamin E may marginally improve glycemic control through its anti-inflammatory effects and by enhancing insulin sensitivity. To ensure adequate intake, it is advisable to consume foods such as almonds, sunflower seeds, spinach, and avocados. Though most people require supplementation, especially when higher antioxidant protection is necessary, the recommended dose is between 200 and 400 IU of natural vitamin E, D-alpha tocopherol, daily, favoring the natural form for superior absorption and utilization. Excessive vitamin E, particularly via supplements, can increase bleeding risk, especially in those taking blood thinners. Medical advice should always be sought prior to starting supplementation. Conclusion: the 5 essential nutrients discussed, magnesium, vitamin D, chromium, omega-3 fatty acids, and vitamin E, each fulfill a vital role in supporting blood glucose regulation, reducing other complications, and promoting overall well-being for individuals managing diabetes. Armed with this knowledge, you are better equipped to take proactive steps towards improved health. If you are interested in further information on natural diabetes management, there is a wealth of educational content available on the subject to support you on your journey to a healthier and more balanced life. Thank you for engaging with this overview. Should you find the information beneficial, consider sharing it to assist others in their health journey. Wishing you continued good health.